Hello, my dear friends. Welcome back. Let us continue our discussion in the low volume topic. And the next topic that we are going to study right now, as you are able to see on the screen, we are going to learn about the femoral triangle. Now, not only the femoral triangle, we are going to slowly go in depth of this topic. We are first going to learn about the femoral triangle, and then inside the femoral triangle, there will be femoral sheath. Then inside the femoral sheath, you'll be actually having femoral canal, and then above that, there will be opening, that is femoral ring. So one by one, we are going to actually study about all these topics in depth. So first femoral triangle, then sheath, then canal, then we'll be studying about the femoral ring and its boundaries. So first, starting with the femoral triangle, where do you actually see the femoral triangle? Femoral triangle, we can clearly appreciate that in the anterior aspect of the thigh. In upper 1/3 of the anterior aspect of the thigh, there is a depression, and that depression is nothing but your femoral triangle. Now in anatomy, you know very well, whenever we have a triangle or rectangle, we need to learn the boundaries of that. Come on. A triangle will always have three boundaries. There will be a base and then there will be two sides. Now in this diagram, I hope you are able to appreciate that there will be anterior superior iliac spine over here, and then there will be a pubic tubercle over here, and between them there will be a ligament, and that ligament will be inguinal ligament, and that inguinal ligament is the one which is going to form the base of femoral triangle. It is going to form the base of the femoral triangle. Now similarly, you are able to see this longest muscle in our body. Mark my words, it is, I am not saying largest, it is longest, lengthwise. So that is the longest muscle, that is the sartorius muscle, and sartorius muscle is the one which is going to form the lateral boundary of the femoral triangle. And similarly on the medial side, it is medial compartment of the thigh, and medial compartment of the thigh, definitely it has to be adductor muscle. But you got to remember which adductor muscle is this one. Is it adductor longus, magnus, brevis? And remember, femoral triangle is actually formed by adductor longus, the medial boundary. Okay, so repeat once more here. Base will be formed by the inguinal ligament. Laterally, there will be sartorius muscle, and medially, you will be actually having the adductor longus muscle, guys. Okay, so let's draw a simple diagram and try to learn the boundaries of femoral triangle first. So femoral triangle, and let us learn first of all the boundaries of femoral triangle. Imagine this one here to be the anterior superior iliac spine, and this here will be the pubic tubercle, and then there will be crest and symphysis. There will be a pubic tubercle, then the crest and symphysis. Now between the anterior superior iliac spine and the pubic tubercle, here there will be a ligament, and that ligament will be the inguinal ligament, guys. Inguinal ligament, and that inguinal ligament is the one which is going to form the base of the femoral triangle. Then laterally you will be actually having a muscle, and this muscle towards the lateral side here will be the sartorius muscle. And then there is a muscle on the medial side. That muscle on the medial side is the one which is actually the adductor longus muscle, guys. Adductor longus muscle. So let us first of all write down all these names here. This ligament here will be the inguinal ligament, and remember, inguinal ligament is the one which is going to form base of the femoral triangle, is formed by inguinal ligament. Similarly, on the lateral side will be having a muscle, and this muscle will be the sartorius muscle, and sartorius muscle is the one which is going to form the lateral boundary of the femoral triangle is formed by sartorius muscle. And then on the medial side, you have got adductor muscle, definitely, and that muscle will be adductor longus muscle. Adductor longus muscle is the one which is going to form the medial boundary of femoral triangle, guys. So I think that is the best way to learn, guys. During our first year MBBS days, mostly we'll be just writing it like a paragraph and mugging up. Instead of that, the best way, draw a diagram like this, things will become easier and you will be able to remember for long term. So base inguinal ligament, laterally sartorius muscle, and medially you have got the adductor longus muscle. Now let us go a little bit in more depth. Now on the lateral side you have got sartorius muscle, but in the exams they're even asking in depth like which border of sartorius. Is it like the lateral border of sartorius or the medial border of sartorius? So my dear friends, remember, out of these two borders, there is the medial border of sartorius, and this medial border of sartorius is the one which is going to form the lateral boundary of femoral triangle. Perfect. Now similarly on the medial side, which muscle do you have? Adductor longus. And again the same thing. Which border of adductor longus? Is it the lateral border or the medial border of adductor longus which is going to form the boundary here? So remember, usually the students will be having a habit from first year MBBS onwards learning like on the medial side it will be lateral border. But here you got to be like literally careful. On the medial side it is again the medial border of adductor longus muscle. It's again the medial border of adductor longus muscle. So adductor longus muscle is not only forming the medial boundary, it is actually also forming the floor of the femoral triangle. That is the reason why this question is being asked in the exam. So what is forming the lateral boundary? To be complete here, it is medial border of sartorius muscle. And what is forming the medial boundary? To be complete here, yes, please write down there as medial border of adductor longus muscle, guys. So laterally there will be again medial border of sartorius, and medially there will be again the medial border of adductor longus muscle. So basically, let me just highlight this entire thing. So whatever I'm highlighting here in the yellow color here, guys, this entire thing is actually the femoral triangle actually. Exactly, this is the femoral triangle, guys. Exactly, that is actually the femoral triangle, the boundaries of femoral triangle. Now, once you are done with the boundaries of the femoral triangle over here, guys, now let us see what is forming the floor of the femoral triangle and what is going to form the roof of the femoral triangle. So let's first of all see in the atlas image over here, and then later on we'll actually draw our diagram also. Now the moment you look at this diagram, I hope you are able to clearly now appreciate the boundaries, guys, the base, inguinal ligament, sartorius, adductor longus, everything. Now let's see the floor. The floor of the femoral triangle is actually formed by 4 muscles. Okay. Number 1, every medical student knows the hip bone is actually made up of 3 parts. Upper expanded part is ilium, then there will be pubis and then ischium. So this upper expanded part here, this is actually the ilium part. Now from that iliac fossa, you can clearly see that there is a muscle coming here, and this muscle is actually referred to as iliacus muscle. Iliacus muscle, and you can clearly appreciate the iliacus muscle further going in the floor of the femoral triangle. It's going in the floor of the femoral triangle, so that is your iliacus muscle. And not only iliacus, along with the iliacus, this muscle here will be the psoas major muscle, and even psoas major muscle is also going along with the iliacus muscle. So that is the reason why I think you people have read somewhere or the other in your anatomy books, these two are named together as iliopsoas, inserting onto the lesser trochanter of the femur. So iliacus and the psoas major, these two together are mostly referred to as iliopsoas muscle. And then this small muscle over here will be the pectineus muscle, and this one I just now told you, that is adductor longus only. Adductor longus is going to form the medial boundary as well as it is present in the floor of the femoral triangle also. So what are the 4 muscles which are going to form the floor of the femoral triangle? That is iliacus, psoas major, pectineus and adductor longus. Okay. So let's draw this diagram here now. So let us now see the floor of the femoral triangle. Anterior superior iliac spine, and this is the pubic tubercle. Between them there will be a ligament here, that is inguinal ligament, and then there will be a sartorius muscle over here, and this is the adductor longus. Now we are not going to write down the names of these one, already it is done. Now our concentration is mainly on the floor right now, guys. So remember, the floor is formed by, number 1, there is a iliacus muscle over here along with the psoas major muscle. So this is iliacus muscle, and this one here will be the psoas major muscle. And then there is one more muscle over here. This one will be actually the pectineus muscle. Pectineus muscle, guys, and this one here will be the adductor, and that is adductor longus muscle. Adductor longus muscle, sir. So in total there are like 4 muscles in the floor. The floor is formed by iliacus and the psoas major and pectineus, and then the adductor longus muscle. Iliacus and the psoas major and pectineus and adductor longus, all the 4 of them are going to form the floor of the femoral triangle. Now what about the roof of the femoral triangle, sir? Oh, that is something very much interesting, and there are so many questions recently being asked from here. This will be actually the roof of the femoral triangle over here, guys. And in the roof of the femoral triangle, first of all, try to understand, you will be having a fascia here, and that fascia will be nothing but fascia lata. In the thigh region, the fascia is known as the fascia lata. So you are able to appreciate this fascia here. Just imagine that fascia here to be the fascia lata. Now in that fascia lata, you're able to appreciate one opening here, and this opening is actually referred to as the saphenous opening. There'll be an opening in the fascia lata, and that opening is nothing but saphenous opening. And there you can appreciate, yes, the greater saphenous vein. The greater saphenous vein is the one which will come and drain the blood into the femoral vein, which is passing inside here. So femoral vein, into that the great saphenous vein will go and drain the blood, guys. And apart from that, in that superficial fascia, you are actually able to see certain superficial vessels over there. Okay, so in all the three directions you'll be able to see there. So here number 1, I'll just write down here as number 1 there. That is nothing but towards the pudendal, that is superficial external pudendal vessels. And number 2 here, this one will be the superficial circumflex iliac muscles. And the number 3, this one which are cut here are actually the superficial epigastric. So the best thing, don't get confused with something or the other over there. They're all present in the roof. In the roof, they'll be all like superficial ones only. So it is superficial external pudendal, superficial circumflex iliac, and then superficial epigastric vessels. So let's draw a diagram for this one so that the things will become easier for us. So now we are actually going to learn about the roof of femoral triangle. And again the same thing, guys. Imagine this one to be the anterior superior iliac spine and pubic tubercle here. And this one here will be the sartorius muscle, and this here will be the adductor longus muscle on the medial side. Now this entire thing over here, first you got to imagine that in the roof you'll actually have that skin and superficial fascia, and the fascia in the thigh region is referred to as the fascia lata. This fascia in the thigh region is referred to as the fascia lata. So you just imagine whatever I'm highlighting here in the blue color, this is actually a fascia, and this one will be the fascia of the thigh known as the fascia lata. Perfect. Now what is going to happen here is that there is a vein, the great saphenous vein, and that great saphenous vein is ascending all the way from here, and finally it's going and draining into a vein that is nothing but your femoral vein present over here, guys. So that's great saphenous vein, and great saphenous vein will go and drain into a femoral vein over here. And yes, I'm more concerned about this opening here. What is this opening in the fascia lata known as here, guys? This is actually referred to as your saphenous opening. Saphenous opening. And what about this vein here? This vein here will be the great saphenous vein. And we are going to learn about that separately. Don't worry about that one, guys. It's going to begin all the way from the foot. So that great saphenous vein is beginning from the foot and then traveling all the way through the leg and then the thigh. And in the thigh, the great saphenous vein will go and drain into the femoral vein there, guys. Perfect. And one more thing where most of the students are actually getting confused there, the opening in that fascia lata will be saphenous opening. Fine, well and good. But near that opening, what is going to happen? There will be a fascia which is sieve-like. I mean to say there will be like small openings into that one. And I think you all remember, whenever you come across a sieve-like structure where we have like multiple openings in anatomy, it is actually referred to as cribriform. So that fascia over there is referred to as the cribriform fascia, guys. So don't get confused between cribriform fascia and the fascia lata and all. Let me just put it all this together once more, guys. Let us summarize this. The fascia in the thigh region will be the fascia lata. In that fascia lata, you have an opening there, saphenous opening, and that will be actually covered by again a fascia which is actually having small openings in that, like sieve-like openings, and that is why it is known as the cribriform fascia. Have a clarity in that one. Now, apart from all this, what else do you have in the roof of the femoral triangle? Yes, you will be having certain superficial vessels over here, guys. Superficial vessels in this direction, and then from here, and then even from the here also. Now, if these are the veins which I have drawn in the blue color, accompanying the veins always will be actually having even the arteries also, guys. So you also have the arteries, all those superficial branches of the femoral artery only. So because all these arteries and veins, I mean to say vessels, are present in the roof, definitely in their name you will be actually having superficial, guys. So what is the name of these vessels here? This is superficial external pudendal vessels, both artery and the vein. Superficial external pudendal vessels, and this one here will be the superficial epigastric vessels. And I want you all to be like really careful here. Don't write that in short form as SUP. It's not superior, it's actually superficial epigastric vessels. Why? Because we also have superior epigastric vessels also, and we learned that in the thorax topic. So in thorax topic, just adjacent to the sternum, you'll be having internal thoracic artery, and that will be ending by dividing into superior epigastric artery. So that is superior epigastric, but here this one is superficial epigastric vessels. And apart from that, what about these vessels over here? This will be superficial circumflex ileum.